Ketamine therapy is the next frontier in the treatment of depression and brain fog. For treatment-resistant depression, anxiety, and PTSD, and even for executive burnout, ketamine can be a reset button. I've seen patients go from hopeless to clear-minded in a single treatment. The science backs it, but the stigma doesn't. When used responsibly, ketamine isn't a party drug. It's a doorway to real mental healing. In my opinion, traditional medicine reaches for SSRIs and SNRIs, first-line therapy, when treating anxiety, depression, and a host of other sort of mental illnesses. When in fact, I feel that those providers should be considering ketamine and other psychedelic therapies as a first-line treatment. Why? Because SSRIs and SNRIs are lifelong prescriptions that need to be taken on a daily basis that have associated side effects. Psychedelics and ketamine, on the other hand, short-term and provide long-term lasting relief that often doesn't require repeat therapy. So why wouldn't you at least consider short-term, non-lifelong therapy before a lifelong therapy when looking at treatment options for these conditions? Ketamine and other psychedelics help boost neuronal plasticity, which can help remodel the brain, which can actually cure many mood conditions or mood disorders that are thought to be chronic conditions. Fortunately, ketamine therapy is becoming more widely available. When you're looking for a ketamine provider, make sure it's somebody who's doing an adequate medical screening process, because there are certain medical conditions where ketamine and other psychedelics should not be used. Some examples include diagnoses such as schizophrenia, schizoaffective disorder, bipolar with a tendency towards severe mania, and other medical conditions including some cardiovascular and respiratory conditions. So you want to make sure you have a knowledgeable professional who can help screen to make sure that it's a safe option for you. Additionally, you want to make sure the proper monitoring is adhered to during treatments, and ultimately, and what may be most important for long-term effectiveness, is making sure that the integration process, which is the process after the therapy, is adequately managed, sometimes involving a therapist, because that work is crucial for the brain remodeling that I referred to earlier. If you have any more questions on this topic, just leave a comment below.